Good afternoon, everyone. Welcome to today's town hall. We'll get started in just a moment as our viewing audience is able to join. I'd like to see the numbers increase just slightly before we formally begin with some housekeeping. We have some operational updates as well as epic updates today for our town hall. We'll also leave time, as is our custom, for celebrations. And get started in just a moment. We're able to start promptly at 11:30 today, so hopefully we can get everyone back to your busy workday as quickly as possible. Okay, well, seeing things are leveling out. I'm not sure what our viewing audience will arrive at today. We usually see numbers increase in the first 5 minutes, so we can get started with our official program. I'm Aaron Levo, the Vice President of Communications and Public Affairs. Pleased to be here to help moderate today's town hall on Thursday, July the 14th. A little housekeeping for everyone. We will have the Q&A function open today. You can ask questions using Q&A. Please keep the chat function. We'll use that for celebrations later. As our panelists are able to answer your questions, you'll see those answers accumulate in the answered tab of the Q&A function. So you can go in there and look at the answered questions. If we don't have an expert available to give you an answer today, we'll be sure to email you one. So please log on with your name so that we can respond to you at your HHS email address. And if something comes to mind after the fact, you'll also be able to email questions or comments to the HHS News at hhsc.ca inbox, and we'll put that up a little later in today's slides so that you can have that at your disposal. All of this, of course, is available on the Hub. Encourage your colleagues that maybe weren't on shift or weren't able to make it today to watch this town hall. If you see something that you think they'd be interested in, they can view it later online. Okay, so that's quite enough out of me. Rob McIsaac wasn't able to join us today, but we're very pleased to have Sharon Pearson, our EVP Clinical Operations, Chief Operating Officer, and Chief Nursing Executive to lead us through today's town hall. So Sharon, over to you.
Great, thank you, Aaron, and good morning, everyone. To start, I'd like to acknowledge that we are privileged to provide care on the lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of Indigenous peoples as keepers of this land. So to start today, I do want to talk a little bit about the COVID situation. We are going to talk about screening and masking. I'll give my usual operations overview, and we have Dr. Lum here with us to talk about EPIC in just a little bit. So in terms of the COVID situation, currently, unfortunately, what we're seeing is locally, there is an increase in transmission. And as we know, the lagging indicators of transmission are hospitalizations and ICU admissions, but the modeling is suggesting that the hospital cases will start to rise now and into the fall as the seventh wave approaches this summer. So unfortunately, a larger wave is expected mid-fall when all of us move indoors and the subvariants continue to circulate in enclosed areas. So I hate to say it, but unfortunately, we are not out of the woods and we cannot let our guard down yet. The good news is the province just expanded access to second boosters for those that are 18 and older, as I'm sure many of you heard on social media over the course of the last 24 hours. Certainly, healthcare workers remain at high risk of exposure and would encourage everyone to get that second booster, yes, as soon as you're all eligible. And just as a reminder, that's 5 months after your last booster. There are, as we know, lots of conversations about the additional, more customized vaccines, the polyvalent vaccines. They are not available at this time, so we would not encourage folks to wait for those, but to access those that are available to us. The other news from this morning is that vaccines for children between 0 to 5 have been approved. And so I would think should be available to us by the end of the month, but more will come on that, which is great news for all of you with children and young families, and also for our community that are looking to protect their families and their children against the virus. Certainly, we know vaccine uptake has a direct effect on the severity of COVID and the COVID wave in a community, and vaccines remain the safest and best form of protection for us. So we do encourage everyone to access those boosters and your regular vaccines. Lots of additional information is on the hub, so would encourage folks to seek additional details there. In terms of where we're at, in terms of screening and masking, as of yesterday, you will note that HHS shifted to passive or self-screening for essential caregivers and visitors and support individuals accessing our sites. And you will see signage posted across different areas of HHS. Patients will continue to be screened when they reach their clinical destination. This approach is consistent with what's happening within other hospitals in the HNHBB and really across the province as well. And lots of conversation and planning has happened with our clinical areas to prepare for this change in the practice that occurred yesterday. From a masking perspective, really important to note, although quite clear, I think, is that our policy has not changed and everyone will be expected to wear a mask while they are in our hospitals. We do ask if you run across individuals, as I did this morning, that are not wearing their masks or wearing them inappropriately, that we remind them of our masking policy. And certainly, if you do meet some challenges in that conversation, we encourage you to reach out to security to support those conversations. Obviously, the COVID trajectory remains very fluid and we'll always be assessing our infection control practices and policies in light of what's provided to us from public health in response to the evolving epidemiology that is happening. So that's a little bit of an update on where we're at with vaccines. And you can see the additional information on the boosters there. I can move on then to my operational update and where we're at with COVID numbers. So this is a little bit dated from 2 days ago, 15 patients, less than 5 in the ICU and only 1 outbreak at St. Peter's Hospital. So that's good news. Unfortunately, we are seeing that gradual uptick of staff in self-isolation. So we're up to 191, and I think it's just above that today. In terms of our occupancy, sadly, I just sound the same. I know when I give this update, but we continue to be very pressured across all of our sites, acute and post-acute, as you can see the numbers on the slide. And again, our ALC remains always in that range of 185 to 200. I cannot underestimate the inordinate pressure I know that these occupancy numbers put on our EDs, but also on all of our inpatient areas too. And I know it is a struggle to keep up with the volumes and acuity that we are seeing. If you could move to the next slide. The ED pressures, again, lots of media conversation this week, last week around what is happening, particularly in some of our smaller communities and their EDs needing to close as a result of both physician and or nursing or allied health shortages. There is significant planning occurring within the HNHBB and Ontario West region to ensure we can do all we can within hospitals, but within our community agencies, home and community care and other providers, and those are not subsiding, unfortunately. Continue to be provincial conversations about what else can be done. We have tried to advance our surgical activity, but again, very limited by volumes of unscheduled care, but also because of our HHR shortages. So we remain at 75%. Lots of, again, planning within Hamilton and within the HNHBB in terms of how we can address some of those increasing wait lists that we're seeing, and always ensuring that we're getting to those urgent cases. We do have a number of specific pressures in our specialty programs. I'm only calling out 2 here, but there are certainly others. Significant pressures within our stem cell program, significant pressures within NICU as well. And lots of pressures within other regional programs included in that. And again, a number of tables, many of us were at those tables this week trying to sort out how to maintain flow now, not only within Hamilton, but across the province. So sadly, we continue to feel the effects of COVID, and we are anticipating that increase coming to us now through the fall, but we are doing lots of planning to ensure we can be prepared or as best prepared as we can. So with that, I will hand it over to Dr. Lum.
Hey, everybody, here again. Day 40 after go live. And I know for everybody in the organization, it's been a wild ride, and that we wouldn't for 1 second say anything other than an enormous thanks for what's, I'm sure, been difficult for everybody. But I do think, there's every reason for optimism that we are actually making steady progress as we go from the moment of go live into the stabilization phase, which will take us many more weeks before we feel that we've gotten to that point. And then what I think is probably the most exciting part of this, which is optimization and the opportunity to really start to exploit this new tool that we've got to help us provide the kind of care that we really want to. Next slide, please. So where are we today? Well, it's 40 days since we went live, and the activity in terms of tickets is slowly coming down. We were getting over 2,000 tickets a day in the first week or so, and we're now down into the 400 range. We do have a significant number of tickets that are open, and the team is actively looking at the best strategy to try to bring these tickets under themes and decide on A, the priority, and B, the timing of when these can be addressed, whether some in fact no longer need to be considered active, and how we might go about addressing that. And then, of course, many will inevitably fall into the phase of optimization, and that's where we need to ask people for patience. If this isn't something that they need to resolve today in order to do their work, then we may have to start to slow this process down in recognition of the tremendous amount of work that the team is continuing to do. In terms of the at-the-elbow floor support, the plan has always been to slowly wean ourselves off the at-the-elbow support, and by the end of 8 weeks, we won't be having the blue and yellow vests available to the organization. We also acknowledge absolutely the incredible pressure from the clinical side of the house, and so many of the super users have been released back to their clinical duties earlier than we would have preferred. But I think we have a pretty strong indication that the units are now in a circumstance where people can continue to support each other, even if they aren't formally described as a super user at the very beginning. There are areas where we have ongoing challenges, and the Central Command team is looking at strategies about how we will keep this work going, what items have to be a very high priority, and as I said, what items we can defer to a little bit later. Referrals, results and documentation, routing, issues around the MyChart app cancellation option that was put on hold, and then considerable work for providers on management of their in-basket pools. All are pretty high priority items every day at the command center. Just a quick celebration. We're now well over 10,000 MyChart registrations. The interest continues to climb, and I think this is going to be a huge win as we start to get more and more people registered. Next slide. The team does kind of like to throw around numbers to highlight how big and how complex this has been, and I won't belabor this too much, other than where you see at the 11 o'clock position here, 142,000 messages have gone through the secure chat system already. This is a tremendous opportunity for people to connect around clinical care. I will say a couple of more words about secure chat on the next slide. lots and lots of my chart registrations, as I mentioned, and an incredible number of records that have been shared between other organizations, and which I have mentioned before, exploits the interoperability characteristics or opportunities of the EPIC product, so that we can communicate with our other EPIC colleague institutions across the province and truly actually internationally. A couple more words about support. I did mention that we'll be weaning off our at the elbow supports, and that many of our super users have returned to their clinical activities. That doesn't mean that there isn't help available. It doesn't mean that you shouldn't be searching out your ATEs while you can. And I would really encourage you to take advantage of the virtual ATE support. We get pretty strong positive feedback on this option, and the time for the call to be answered is very reasonable, and I think you're going to find that most, if not all, of these individuals are extremely knowledgeable in the EPIC environment. So please take advantage of that. And the next slide. So many of you may have heard of OLIS, which is the Ontario Lab Information System, where organizations and the private labs submit their results to the OLIS repository, and then that information can be seen by practitioners. This is a really, really important tool for the frontline clinical care. And thanks to Michelle and her team, we were able to be the first institution in Ontario to take advantage of a new interface called FHIR. And all of the OLIS results on our patients are available now within EPIC. I've used this many times already, and it's really a tremendous opportunity to be able to see what's going on in patients who've had outpatient results or lab work done, and the results are available. There were issues around the pediatric armband, and I'm pleased to say that that has been resolved. There was a number of people walking around the command center with armbands on over the last couple of weeks to make sure that they couldn't wear them out and that they would still be readable. So I think we've made a real progress in that regard. You may have seen communication around the preference list for medication ordering being renamed, and that's a response to feedback that we've had. And I will tell you that the opportunity for patients to cancel or request cancellation, I think is probably the better term, of an appointment will be turned on in a couple of weeks once we get all of the appropriate pools in place to be able to respond to those. We have made changes in that, and the two important ones are that instead of 24 hours, we're extending it to patients not being able to cancel any less than 96 hours from their appointment. This gives the clinic folks a chance to fill open spots that would have otherwise gone as a no-show. And we're also going to make this a request for cancellation rather than the patient actually able to enter the schedule and cancel the appointment directly. So that will be coming back on. There will be kinks in this, and we know that that's the case. So we very much want to hear from you as we go forward with that. And I think, oh yes, I do have one more, a few more reminders about RIP tickets. I think I've covered that. If you're having issues related to patient flow, and this relates to the ability to get a patient admitted or get a patient transferred, please don't wait on that. If you wait more than 20 minutes to get that issue resolved, we want you to call the helpline and escalate that. Or if you've used your ATE, they should be helping you call the helpline and take advantage of the opportunity to escalate this quickly. We don't want patients waiting around for long periods of time who need to be admitted, especially if they're in a clinic and they're sick. I would mention that Secure Chat is extremely popular. As you saw, that 142,000 secure chats. but it is not meant to be a way to avoid picking up that old-fashioned device called a telephone and talking to your colleagues if there are urgent or emergent issues. This is meant for clinical care, but it's not meant for emergent or urgent clinical care. And please pick up the phone, talk to your colleagues. That's still the most important and effective way of communicating. There are ongoing issues related to the use of phone orders and verbal orders, and there is a process for this. My plea is that this is a collegial conversation between providers and their nursing colleagues, so that yes, we absolutely want doctors to enter their orders whenever possible, but under circumstances where it's appropriate, please don't hesitate to take a phone order. Optimization I've talked about, this will be coming down the line. And I will say for providers that we're starting drop-in sessions to either complete their first or to update their user settings lab opportunities for personalization of their own activities within Epic. And of course, don't forget about the hub. Everything that we talk about here is available on the hub whenever you need or you want to take the opportunity to have a look. Last piece relates to what I've mentioned before, and that is this organization is going through a massive change, and we know that patients are asking questions and they're sometimes a little bit perplexed on what's going on when everybody is looking at that big Epic screen, or they're walking around scanning people with what looks like a garden variety iPhone and so on. So there are tips and so on available to help you converse and discuss with your patient. Please take advantage of those, and please try and continue to ask our patients for their patients as we continue to move down this path. I think that's it for me.
Okay, thanks very much, Barry, for that update, and also Sharon for your remarks. Just reminding everyone that you can email questions to the questions line at hhsnews@hhsc.ca. I think we've got a couple Epic questions in the queue, in our Q&A, and I'm sure Barry and others will take a look at those in a moment. But if there's something that comes to mind after the fact, you can always email it to that line and we will get you an answer as promptly as we can. Okay, so we do, as is our custom, have time for celebrations now at the end of our agenda. If you have a celebration you'd like to make, you can either type it into the chat forum and I'll read it out, or you can raise your hand and we'll call on you to give your shout out live. You might want to think about recognizing an individual, a team, or an accomplishment, something that's happened across our sites and services. I see one here from Morgan Richardson, thanking all stakeholders involved in the discontinuing of our screening services. Special mention goes out to our site leads. Here they go. Jody Castleman, Sam Chivers, Kim Dungavel, Leanne Parsons, Lee Kirshner, Angie Ratzlaff Lane, who oversaw operations and provided support to our screeners, and to Nate Vanden Duel for his leadership throughout on this process. For sure. Thanks, Morgan. And thanks to all of our screeners who provided such a valuable contribution to HHS during their time with us. Great work to stand that up and to take it down. Let's take a look at our participants. Do we have anyone with a hand up? As well, our panelists are welcome to give a shout out too. It is your time as much as our viewing audience. We have a relatively smaller viewing audience today. Congratulations and thank you to Michelle Stevenson from Bruce Squires, who is our Women's and Children's Executive Assistant, who is leaving HHS or Master Children's Hospital to join the City of Hamilton. So thank you, so thankful for all you've done. For sure, congrats, Michelle, on that transition. Also from Wendy Sidelights, thank you to all of our super users and Odyssey staff, so valuable and helpful. Another, can never say thank you enough to all of our super users and Odyssey team for what they've had to lead us through, for sure. Thanks, Wendy, for calling that out. Okay, well, we'll give it, I know it sometimes takes a bit of time to type one in there, but it seems like we're slowing down. Anyways, we can always all read the shout outs as they come in. So thanks to everybody. Maybe Sharon, I'll give closing remarks to you. Thanks to all, and we'll see you next time.
Great. Thanks, Aaron. And thanks for everyone for joining us today. I do hope you're all getting some time off this summer to relax and enjoy good weather. As always, please keep an eye on the hub where we'll post our most recent and important updates. And our next town hall is scheduled for July 28th. So we will see everyone then. So thank you and have a great day.